Howdy, Ags. Our group members are Abby Wimmer, Mason Hoover, Britton Burns, and Colin Scapel, and today we'll be talking about two major diseases that impair people's nerves and the nervous system. The diseases we'll be talking about are Alzheimer's and Parkinson's disease. We'll discuss their causes, symptoms, diagnosis, and treatment in depth for each of them. The nervous system. So just some basic information before we go into the diseases. The nervous system is the function of transmitting and receiving electrical signals throughout the body. They can be voluntary, involuntary, like controlling your organs or your heart. The nervous system has a lot of influence on how we live our daily lives. It is composed of two components, the central nervous system and the peripheral nervous system. And all the signals that we receive and transmit are done through neurons. To our right, we have a picture of a neuron body. And it's just like a good idea, like a visual representation of when we talk about these neurodegenerative diseases that cause these neurons to stop working.
All right, our first neurological disease of the day is Alzheimer's disease. Many of you may be familiar with this disease, as it is very common among the elderly. This image depicts how it feels to have Alzheimer's. The disease destroys nervous connections in the brain, so it feels as though you have a puzzle to put together in order to get your thoughts straight. All right, so here we have a little brain imaging of Alzheimer's before and after. Alzheimer's disease attacks the nervous system by destroying nerve connections in the brain within the frontal and temporal lobes. Alzheimer's is a progressive disease, so as it gets worse over time, the brain cells degenerate and will eventually die off. As the symptoms continue to worsen, the disease progresses into large-scale dementia, into which the individual will lose functionality of previously familiar tasks. Things like thinking, reasoning, speaking, and remembering become increasingly difficult. After long enough, the mental brain capacity of the patient will decrease to the point that the brain completely fails, ultimately leading to the death of the patient. So right here above, you can see the picture to the right. We have a comparison of a normal healthy brain as well as one of Alzheimer's. The Alzheimer's disease brain has a considerable amount less of brain activity due to the nerve connections that have been destroyed.
So now on to the causes for Alzheimer's. Scientists believe that Alzheimer's is caused by genetic, lifestyle, and environmental factors, though the main physiological cause of Alzheimer's is brain cell death. So the brain cell death in Parkinson's is theorized to be caused by two methods. The first method is the development of amyloid plaques in the body. These are just large protein scraps and debris that cluster together, and these are toxic to the brain cells that cause them to die. The other method that causes brain cell death is neurofibrillary tangles. And these are caused by tau proteins. These proteins are part of the support system for the brain cells. But when these proteins get twisted out of shape, they block that support path, and the cells don't receive the support they need, and they die. So our brain gets to this point through a variety of risk factors, but one of the greatest is aging. You can see in the study that annually there were 2 new diagnoses per 1,000 people ages to 65 to 74, 11 new diagnoses per 1,000 people ages 75 to 84, and 37 new diagnoses per 1,000 people 85 and older. You can clearly see there's a correlation between aging and your risk of developing Alzheimer's in the study. There's a huge jump from age 75 to 85. And then elaborating a little more, genetics is important in Alzheimer's. If you have a close relative that has the disease, you'll be at higher risk. Lifestyle factors like poor sleep and your heart health also are seen to have a role in the development of Alzheimer's. Lastly, if you look at this picture here, you can see the nucleus of a normal brain cell, and then you can see the nucleus of an Alzheimer's disease brain cell. And a lot of the DNA that's normally tightly packaged in the cell has kind of been scrambled all over, and the cell is damaged. Now, there are a variety of symptoms that come with Alzheimer's, and there's also some diagnosis methods. The damage starts in the part of the brain that controls memory, so mostly your frontal and temporal lobes, but the process can start years before symptoms. The symptoms usually start with memory loss, and as the disease persists, memory impairment will worsen. Moreover, the person will start to have judgment issues. For example, they may make poor choices in social interactions or wear inappropriate clothes for the weather that day. Because this disease affects the brain so much, there can be a complete change in personality and behavior in the individual, ranging from like depression and mood swings to irritability. With all the loss in functionality of the person, there can be some preserved skills that seem to last because they were likely affected later in the course of the disease. The first diagnosis of Alzheimer's disease usually comes from a close friend or relative that notices the changes happening in a person. Even the person doesn't immediately realize it. However, there are people that still self-report symptoms and kind of hypothesize that they have Alzheimer's. Laboratory and imaging tests are the most efficient way to diagnose a patient with Alzheimer's.
All right, now on to treatment. There's currently no cure for Alzheimer's, but there are some drugs that kind of help with the memory loss and cognitive changes that are going to go on through the course of the disease. Drugs like cholinesterase inhibitors and melatonin drugs that works to slow down the effects of Alzheimer's. Also, the cholinesterase inhibitors block normal deterioration of acetylcholine, which is the primary neurotransmitter within the body. Menematine drugs are an NMDA receptor antagonists, so they work to decrease abnormal activity in the brain. The best way to treat someone with Alzheimer's is through a safe and supportive environment. Often this is hospice care is going to be a common treatment for these people where specialists are trained and to work with people with dementia, because it's going to be a hard thing to work with. People are going to have a lot of problems and it's hard to deal with and very stressful. The patient will likely forget the setting they're in and may even forget what time period they're in, often referring to close family and friends as people who have long since passed away or someone they have not seen in a long time. So while research and development of treatment to stop the disease has been slow and ineffective to this point so far, the 6,500 participants of clinical studies is certainly aiding research terms. So, I mean, we're trying to find a cure for this always. But for now, it is important to make those affected feel as comfortable and supported as possible in the hopes that one day the scientific community will discover a way to halt the disease dead in its tracks.
The next disease we are going to talk about is Parkinson's disease. Right here, we have a nice little photo showing the typical signs of indication of a person having Parkinson's disease and some of the symptoms we will talk about later.
So Parkinson's disease is a neurodegenerative disease that affects the neurons that deal with the product of dopamine. So pretty much in simple terms, it's the deterioration of neural tissue. With this disease comes loss of motor functions by affecting nerves. Simple daily functions become increasingly difficult. This disease can also be heritable or sporadic, but most people that contract it are in their 60s or 70s. However, there can be early onset Parkinson's that occurs in the 50s, but primarily this disease affects the elderly population. The picture on the right shows a brain image showing the activity in the dopaminergic neurons in a normal person's versus someone's diagnosed with Parkinson's disease. The brain on the right has a significant decrease in activity of these neurons because there are less dopamine transporters in a Parkinson's patient's brain. So causes. So there are several things that affect the symptoms that are associated with Parkinson's disease. There are various ways that a person can contract this disease. As we mentioned earlier, this can be hereditary, but it can also occur in people without any previous family history via mutation. Scientists believe that this comes from some sort of genetic or environmental factor. Scientists know that the death or damage of the dopaminergic neurons are what causes Parkinson's disease, but they are not for sure about what causes their death and damage. More research is still being looked into this, but it is known that these two are associated. People with Parkinson's also may have the loss in function of nerve endings that produce norepinephrine. These control many important functions in our body that are involuntary and automatic. Things like blinking, good blood pressure, and heart rate are affected by this. And then Lewy bodies can be found in several patients with Parkinson's, but not all will develop them. Lewy bodies are formed from a congregation of the protein alpha-synuclein. Lewy bodies are seen in several neurodegenerative diseases, and though the function of the alpha-synuclein protein isn't completely understood, it is believed to be involved with the neurotransmission of the dopaminergic neurons. To the right, you can see a picture of a Lewy body.
All right, so the symptoms and diagnosis. There are a few common symptoms that people living with Parkinson's disease may experience. Tremors can vary in style, but they usually occur in the hands and arms, legs, and sometimes jaws. Parkinson's disease usually causes people to become very stiff in their movements. They're very rigid. And the bradykinesia is a specific slow movement. It is often associated with the losing of normal functioning of the automatic movement we've talked about on the previous slide. Parkinson's disease often affects speech patterns and like the ability to chew and swallow things because of the tremors in the jaw. They lose a lot of use in their mouth. And there's also issues with writing with their hands and the tremors. Poor motor functions will reduce the use in the hands and make normal daily functions difficult. It also causes a loss of imbalance. And for the diagnosis, there are currently no blood tests that help determine if a person has Parkinson's disease. Doctors base off the diagnosis off of medical histories, signs of symptoms, and neurological examination. They can do a DAT scan of specific areas of the brain, but most doctors tend to not do that because it's not needed when the symptoms are very present. What doctors do is they make several follow-up appointments with a neurologist to track the and evaluate the motor skills and symptoms over time. There's also the practice of being given low doses of carbidopa levodopa, which is a specific Parkinson's medication. And if your condition improves with this, that's a good indication you do have Parkinson's disease. For treatment, there is no cure, but you can treat these symptoms. Carbidopa levodopa is a medication that passes through your brain and acts like dopamine. This is just tries to reestablish the dopamine levels in your brain to have better function. But as the disease progresses, the medication can wear off to where you'll have some really good days and some really bad days. And when you have some really bad days, dopamine agonists are added to your medication because they act like the drug dopamine instead of transforming to it. They aren't as effective as a levodopa medication, but when combined together, they act really well. You can also have a surgical procedure called deep brain stimulation, as seen in the picture to the right, where they'll put electrodes in your brain that's connected to a generator that's located on your chest. The generator will send shocks and to the electrode to help with the tremors and other symptoms of PD to help kind of control them a little bit more. This is usually used for more advanced cases of Parkinson's disease, and also if like you don't respond well to the medication. So the important thing is that there's not a cure, but you can cure the treatments to where life is more manageable.
So now we're on to our exam questions here. So our first exam question is, what are some of the symptoms associated with Parkinson's disease? We have A, tremors, B, rigidness, C, poor balance, D, A and B, or E, all of the above. And our answer here is E, all of the above. These are all symptoms associated with Parkinson's disease.
All right, for exam question 2, what is one of the goals of current Alzheimer's treatments? A, handling memory loss, B, stopping tremors, or C, restoring ability to balance, D, both A and B, or E, all of the above. The answer is A, handling memory loss. The current goal of Alzheimer's treatments is just to handle memory loss. That's the main thing that happens in this process of the disease. It's not to stop tremors or restoring the ability to balance, because those are both things that happen with Parkinson's.
All right, then our third exam question is, what part of the body does Alzheimer's attack? We have A, the respiratory system, B, the nervous system, C, the circulatory system, D, the urinary system, or E, the digestive system. Now our answer is B, the nervous system, because Alzheimer's attacks the frontal and temporal lobes of the brain, which are nervous system.
So here are some of our citations. We'd like to thank all the people who allowed us to gain knowledge about these two diseases. Here are the rest of our citations. Thank you for watching. We hope you learned a lot about the nervous system, and specifically Alzheimer's and Parkinson's disease. Thanks, and gig 'em.